Imagine hearing this and immediately feeling relief. Nothing is wrong with you. You're simply in a new phase. For decades, you relied on a quick, firm, goal focused routine. It worked. But past 60, your biology shifts. Testosterone eases downward, nerves take longer to fire, and small blood vessels stiffen a bit. The old approach, fast, tight, outcome obsessed, can backfire. It may blunt sensation, irritate thinner skin, and clamp down on blood flow. Today, we'll update your technique so it protects your body, respects change, and actually boosts pleasure. Stay with me because by the end, you'll have a step by step routine, recovery tips, and simple upgrades that help you feel more confident, connected, and in control. First, reframe the goal. This is not a performance test, it's intentional self care, calmer, smarter, and surprisingly more satisfying. Start by creating a safe window of 15-20 minutes with zero interruptions. Set softer lighting, recline with support behind your lower back, and let your jaw loosen. 5 slow breaths, nose in, mouth out. Signal your nervous system, I'm safe. That single cue improves blood flow by dialing down stress chemistry that competes with arousal. Now, preparation. Apply a gentle, unscented, water-based lubricant early before you're fully aroused. Thinner skin after 60 benefits from Glide. It reduces microfriction and helps your brain register touch as pleasant rather than abrasive. Warm your hands. Begin broadly. Lower belly, inner thighs, perineum. Like a massage, not a machine. Think slow, steady, rhythmic. When the nervous system processes signals at a calmer pace, sensation feels richer and more controllable. Grip is the next upgrade. Trade the old vise for a relaxed, responsive hold. Your aim isn't force, it's fidelity. Cleaner, clearer sensation with less effort. Use partial strokes, vary angles, and add stillness breaks every 20-30 seconds. Those pauses aren't failures, they allow blood to refill erectile tissue and let nerves resensitize. If arousal dips, don't chase. Breathe, adjust pressure, and continue. You're learning a new language your body has been speaking for years. You're finally listening. Position matters more than most men realize. Avoid hard chairs and tight hip angles that compress pelvic nerves. Try semi-reclined with a cushion under your knees, or lie on your side with a pillow between your thighs. This opens the pelvic outlet and reduces tension in the perineum, improving comfort and flow. Gentle heat, like a warm shower beforehand or a heating pad on low over the hips for 5 minutes, can also encourage vasodilation, priming you for a smoother experience. Here's a rapid checklist you can memorize. 1. Safe time window. 2. 5 deep breaths. 3. Lube early. 4. Slow rhythm. 5. Softer grip. 6. Posture open. 7. Pause without panic. Follow this sequence for 2 weeks and you'll feel the difference in sensitivity, control, and satisfaction. Next, add smart body signals. If you notice dullness, shift pace before increasing pressure. If you feel pinching or heat, add lubricant and lighten your hand. If your mind races, count a 4-second inhale and 6-second exhale for 6 cycles. Longer exhales cue relaxation and better blood flow. Treat each session like practice, not a pass-fail exam. Curiosity beats willpower every time. A gentle boost that works with your body. If you want extra support for circulation, look for a natural science-based aid that helps your body make more nitric oxide, the signaling molecule that tells blood vessels to relax and open. The most effective options combine concentrated dietary nitrates, which convert to nitric oxide, key amino acids that help sustain healthy No levels over time, and plant antioxidants that support the enzymes involved in nitric oxide production. The right blend doesn't just target performance, it also helps keep vessels healthy and may even sharpen mental clarity during intimate moments. If that resonates, check the link in the pinned comment to see a trusted option that aligns with these principles and is easy to add to your routine. Before we move on, let's address a common worry. What if climax takes longer or arrives in waves? That's normal. After 60, arousal often pulses. Some days you'll cruise, other days you'll coast and pause. Satisfaction can happen with or without climax. When you stop measuring success by a stopwatch, pressure drops and pleasure rises. That shift alone can restore confidence you thought you'd lost. Let's turn technique into step-by-step guidance you can follow tonight. Start with the warm-up phase, 3 to 5 minutes. Sit or recline with hips open. Place a palm on your lower abdomen and breathe 6 slow cycles. With lubricated fingertips, trace gentle circles along the inner thighs and perineum. Keep shoulders heavy and jaw loose. If you clench, you'll recruit the pelvic floor too early and mute sensation downstream. Transition to the sensation phase, 5 to 8 minutes. Use long, light strokes at half your old speed. Think, glide, pause, glide instead of constant motion. Every 20-30 seconds, stop and simply hold with light contact, no squeeze, while breathing. Notice how warmth and fullness build without force. Vary angle and hand placement. Base to mid, mid to tip, circular sweeps around the shaft, or gentle pressure at the perineum for a second or two, then release. These micro variations wake up quieter nerve pathways and create layered sensation. Now the focus phase, 2 to 4 minutes. If you're feeling responsive, shorten the stroke and slightly increase pressure. Not to your old levels, just enough to add definition to sensation. Use a 3-count rhythm, glide 1-2, pause 1-2. If sensation fades, reset with 2 deep breaths and a longer stroke. Think of this like tuning a radio, tiny adjustments, patient listening, no rush. Finish with the recovery phase, 1 or 2 minutes. Whether or not climax happens, keep a hand resting lightly at the base while breathing slowly. This maintains gentle engorgement and helps prevent the sudden drop-off some men describe. Wipe excess lubricant, drink a glass of water, and give yourself a minute of stillness. Recovery is where the nervous system integrates new patterns. It's as important as the start. Practical upgrades most men overlook. Hydrate earlier in the day. Dehydration thickens blood and can reduce flow. Take a brief walk to wake up circulation and warm your hands before starting. Consider a soft warming sleeve or well-designed textured aids that add sensation without forcing pressure. Think eyeglasses for touch, not toys. If you sit long hours, add 2 short mobility snacks, hip openers, calf raises, and 60 seconds of relaxed squats against a wall. Better circulation during the day pays off at night. About the pelvic floor. Yes, Kegels help some men, but over-tightening can backfire. Aim for balance. Contract on a 3-count, then fully relax on a 6-count. 10 reps, once daily. If you habitually clench when stressed, practice reverse Kegels by relaxing the pelvic floor as you exhale, like gently letting go. Balanced tone improves blood trapping in erectile tissue without creating unhelpful tension. Nutrition and micro habits that matter, a daily serving of nitrate-rich greens, arugula, spinach, or beetroot can support nitric oxide pathways. Magnesium-rich foods, pumpkin seeds, almonds support relaxation. Limit heavy late-night meals and alcohol, which dampen nerve signaling and blood flow. Use a warm shower pre-session to encourage vasodilation and keep your bedroom cool. Thermal comfort improves arousal consistency. Mind-body hacks for harder-to-reach days. Try box breathing. Inhale 4, hold 4, exhale 4, hold 4 for 1 minute to quiet mental noise. Use sensory anchors, a specific playlist or familiar scent, to cue the brain that it's time for calm focus. If worry shows up, what if it doesn't work? Answer it once. I'm practicing, not proving. Then return attention to sensation. Over a few weeks, this retrains your brain toward confidence instead of vigilance, which is the true performance killer. Frequently asked questions, answered fast. Is edging harmful? Use thoughtfully. Brief pause and play can build sensitivity. Just avoid white-knuckle clenching or marathon sessions that irritate tissue. Should I use numbing creams? Skip them. They reduce feedback and encourage too hard pressure. You want more sensation quality, not less. What about porn? If it speeds you up and pulls you out of your body, take a 2-week reset and relearn sensation at real-world pace. You can reintroduce mindful visual cues later. How long should the whole routine take? 10 to 20 minutes is plenty. Short, consistent practice beats rare, heroic efforts. Timeline expectations. Week 1 is mostly learning to slow down. Week 2 brings steadier warmth and return of subtle sensations. Week 3 often delivers better control and a calmer mind. If results feel uneven day to day, that's normal. Sleep, stress, and hydration all matter. Keep the routine. Trends, not single sessions. Tell the truth. Let's troubleshoot common roadblocks so you're never stuck. If dryness or post-session irritation shows up, switch to a thicker water-based lubricant. Apply earlier and reapply mid-session. If you're on medications that dry mucosa, some antihistamines or antidepressants, plan extra lubrication from the start. If numbness appears in a specific spot, you may be compressing a nerve with grip or posture. Rotate angles, lighten pressure, and avoid sitting on a hard surface. If you struggle to maintain arousal alone, borrow momentum from context. Do a 5-minute wind-up. Stretch calves, shake out hands, take a brief walk, then recline. Light activity increases blood flow and primes the nervous system. Some men benefit from a 2-part session, 5-6 minutes, pause for 2 minutes of breathing, then resume. Paradoxically, the intermission makes the second segment more responsive because sensitivity rebounds. Erection quality is largely vascular, but nerves and mindset steer the wheel. For nerves, minimize prolonged direct pressure in one place. Alternate motion with rest and include whole area touch, perineum, inner thighs, lower belly, so the brain receives a richer map of sensation. For mindset, narrate what's working, slower helps. That angle wakes sensation, jaw loose equals more warmth. Positive labeling teaches your brain which switches to flip next time. Prostate comfort matters too. Long sessions with high friction can irritate tissue. Your solution is glide, heat, and rest breaks. If you frequently feel pelvic heaviness afterward, reduce intensity, extend warm-up, and end with a minute of diaphragmatic breathing with a hand over the lower belly. If you notice persistent pain, burning, fever, blood in semen, or urinary changes, that's your cue to schedule a check-in with a clinician. Here's a weekly plan you can test for 2 weeks and then adjust. 2 practice sessions focused purely on technique and sensation. No goal of climax. 1 session with a gentle climax goal. Slow build, pauses, recovery. Daily 5-minute circulation routine. Brisk walk, 30 calf raises, 10 relaxed wall squats, hip opener. Nutrition. 1 serving of nitrate-rich vegetables daily. Hydrate consistently. Alcohol strategic and light. Sleep ritual. Screens off 60 minutes before bed. Warm shower. Bedroom cool and dark. Small numbers, big payoff. Most men notice improved sensitivity within 10 to 14 days, steadier arousal by week 3, and renewed confidence across the board. You'll also likely notice collateral benefits, calmer mood, better sleep, and a quieter inner critic, because you're trading pressure for presence. Let's add a few pros-only micro skills. Angle ladders. Start with long base to mid strokes for 1 minute, then base to tip for 1 minute, then mid to tip for 1 minute. Repeat once. Pulse pause method, 3 light pulses of motion, then a full 2 breath pause with contact only. Repeat for 4 rounds. Temperature contrast, briefly warm your hands, then let them cool, alternating every minute. The contrast sensitizes nerve endings without pressure. Breath sync, tie motion to breath, glide on inhale, pause on exhale. This keeps you in the parasympathetic lane where blood flow thrives. Remember, satisfaction is multifactorial. On days when sleep or stress is off, lower the bar and focus on recovery. Consistency beats intensity. Track progress without pressure. Once a week, jot 3 notes. 1. What helped most, e.g., slower pace, heat posture. 2. 1 micro tweak to test next time. 3. Your general mood before and after. You're building a custom playbook. The notes prevent backsliding into the old autopilot. Create a simple comfort kit. Thicker water-based lubricant, a small heating pad, a soft towel to support the hips, and a bottle of water. Having tools at arm's reach reduces friction, literal and figurative, and keeps you present. If traveling, pack sample-size lube and a stretchy band to do hip openers in 5 minutes. For vascular support beyond the bedroom, stand every hour, walk the long way once a day, and include leafy greens or beets with lunch. A little daylight on your skin in the morning supports nitric oxide pathways and circadian rhythm. Tiny actions, repeated, become the invisible scaffolding of strong performance. Now, about mindset, the unseen engine of reliable pleasure. Many men carry an outdated script: finish fast or it doesn't count. Flip it: feel fully or it's not worth it. When you prize sensation over speed, your body stops bracing. That single shift lowers performance anxiety and frees circulation. Use simple mantras while you breathe. Slower is stronger. Soft is smart. Pause equals progress. They sound small, they work big. When to seek help. Schedule a check-in if you have persistent pain during or after self-touch. Sudden or progressive numbness that doesn't improve with technique changes. Difficulty getting or keeping an erection even in calm private settings. Or distress that keeps you from engaging at all. A brief visit can rule out hormone, vascular, or nerve issues and give you clear next steps. There's no failure in asking, only wisdom. For long-term health, invest in the pillars that support sexual function at any age. Movement. 150 minutes a week of moderate activity keeps endothelial function, the vessel lining system that releases nitric oxide, healthier. Strength. 2 sessions a week keep glucose control sharp and testosterone steadier. Sunlight and sleep. Morning light anchors circadian rhythm. 7-8 hours of sleep improves libido and nerve responsiveness. Food basics. Prioritize leafy greens, beets, berries, fish, and olive oil. Curb ultra-processed foods that inflame vessels. Stress skills. Breath work, a short daily walk, or a wind-down ritual. Beat white-knuckle willpower every time. Build your personal protocol. Morning, 10 minutes of easy movement, plus hydration. Afternoon, brief mobility snack if you've been sitting. Evening, warm shower, 5 minutes of breathing, then your updated routine. Slow, lubricated, soft grip, posture open with pauses. End with recovery and a glass of water. Twice a week, add your circulation support from the pinned comment if you choose. It dovetails with everything here by helping your body produce and maintain nitric oxide naturally. If this guide has you feeling curious or cautiously hopeful, good. That's the point. You're not broken. You're adaptive. The techniques you used at 20 were right for 20. The techniques that honor 60 and beyond are different, and for many men, more satisfying. When you replace hurry with attention and force with finesse, the system responds. Nerves wake up, blood flow feels easier, confidence returns. Give yourself 2 honest weeks. Notice small wins, richer warmth, longer control, a quieter mind. Those are the markers that your new approach is taking root. Before we close, here's a compact script you can follow anytime. 1. Breathe 5 slow cycles. 2. Apply lubricant early. 3. Start broad like a massage. 4. Use a softer responsive grip. 5. Move slowly with rhythmic pauses. 6. Keep posture open. 7. Recover with stillness and water. Repeat this script until it's second nature. When the mind wanders, say, practice, not proof, and continue. Over time, you'll craft your own variations, and that personal fit is what makes the results stick. Finally, if you want deeper education, the next video in this series tackles how self-touch habits interact with prostate comfort and what to adjust to keep the gland happy over the long haul. Click through when you're ready. Take care of yourself, stay curious, and remember, the most powerful upgrade is the one you'll actually use, consistently, calmly, and on your terms.